Let me start with something that usually makes surgeons uncomfortable, which is most surgeons don't know if over the years they are getting better in their job or they're just working for many years. And I'm not saying this as an outsider because I have been a surgeon. Although for some reasons I left surgery to explore something else that surgeons don't think about, which is how our mind affects our performance. That changes how you look at surgery, or that matter, any profession. Because once you understand how surgeons or any performers think, you start to see why results can be so different. That's what this channel is about. Before we go any further, let me tell you who I am and why this matters. I'm Dr. Uttam Shiralkar. I have a rather unusual background. I'm a surgeon and a psychiatrist. And over the past 20 years, I have trained thousands of surgeons in various countries. But here is what makes me different. I have stood on both sides of the operating table, both literally and symbolically. I know what surgeons think but don't say. I know what patients need but don't get. And I know the psychological secrets that separates good surgeons from the average ones. You might be wondering, why should I listen to you? There are hundreds of surgeons on YouTube. Fair question. Let me tell you my story. In the first part of my career as a surgeon, I did everything to become better. I worked my way through surgical training in India, then did fellowship in England, and then in the USA. I worked with renowned surgeons in prestigious institutions. I worked hard to become better. And I did improve. But here is the strange thing. Despite all my hard work, my improvement was random. It was inconsistent. Not as good as I wanted and not as quick as I expected. I couldn't understand why certain things improved without me making any efforts, and how come hours in practice something just didn't change. I know I'm not alone in this. Whether you are in surgery or in any other medical specialty, you may have experienced something like this. You work hard, you are committed, but somehow your progress seems slow, unsatisfactory. I became obsessed with this question. What separates a consistent, predictable improvement from random progress? The answer would come from 3 experiences I had in the United States. Those experiences completely changed my life and my approach towards surgery. The first breakthrough came when I was working as a cancer surgeon in the USA. I discovered a specialty which I hadn't heard before: psycho-oncology, the psychological management of cancer patients. And here is what shocked me. We would perform incredibly complex, difficult surgical procedure. The procedures would be technically perfect. The cancer would be removed totally. And yet, some patients didn't get any benefit, didn't do well. Not because of any surgical failure, but because of psychological factors. Research started showing that psychological support to cancer patients not only improves their quality of life, but their survival rate as well. Think about it for a moment. The mind affecting survival. This was my first aha moment, but there were 2 more coming. The second revelation came from working in 2 hospitals, one government run and other private one. This was again in the USA. I saw the best surgeons I have ever worked with. Magnificent skills, great results. But I also saw the worst surgeons I have ever encountered. And here is what disturbed me. Despite America's robust training system, rigorous monitoring system, and advanced healthcare infrastructure, these terrible below-par performances were accepted or ignored. You may not believe what I am going to say next. In the government hospital over there, I have seen cases which received far poor care and treatment than a government hospital in India. And I'm saying this in all seriousness. Yet, in the private hospital down the road, patient used to get world class, the best treatment possible. How could this be? This degree of disparity can't be explained by politics, by economics, or by individual variability. There was something deeper at play here, something psychological, and I became determined to find it. Then came the moment that would answer all my questions, though not in a manner I expected. I had a serious car accident in the USA. The injuries that I sustained from that accident were so complicated that I couldn't continue my career as a surgeon. At 40 years old, I had to give up promising surgical career and start from scratch. I can't fully describe the darkness I experienced in those days, the loss, the identity crisis, but I decided I would focus on few positive things that remained. And one of the things was opportunity to know psychology. Here is what happened when I worked in psychiatry. Everything clicked. I had light bulb moments from time to time. Suddenly I understood why certain things didn't work when I was surgeon. I understood why my improvement was so random. Why some surgeons excel while others remain flat. The answers were not in books or with teachers. They were in psychology. Why do some surgeons learn faster than others? Psychology. Why do two surgeons with the same background, same technology give different results? Psychology. Why do patients trust some doctors but remain skeptical of others? Psychology. Why do some surgeons burn out while others thrive for decades? Psychology. If I had known these psychological principles when I was a surgeon, I would have become better, faster, more consistently, and with less frustration. And I realized other surgeons need to know this too. So over the past 20 years, I have made it my mission to bridge the gap between surgery and psychology. I have trained thousands of surgeons in various countries. I have published research to prove that psychological training to surgeons improve their performance and patient outcomes. I have written books on these topics, one of which was awarded highly recommended surgical book by the British Medical Association. And now I want to share these pearls of wisdom with you. Let me tell you something I haven't shared with many people. When I first came to England, I was only supposed to be here for 1 year. During that time, I decided to attempt FRCS examination. It was one of the toughest surgical exam in those days. People told me I was crazy to attempt it in 1 year. They used to say that you need at least 2-3 years of preparation. But I cleared it in 8 months. I'm not telling you this to brag. I'm telling you this because of something happened next. The exam results were declared in the evening, followed by a celebratory reception, a lovely British tradition. The room was full of successful candidates, the majority of whom were Indian. Everyone was excited, taking photographs, celebrating the prestigious British qualification. But I stood in one corner thinking, why do we need validation from the West when we have our own systems? Why do we see pat on the back from abroad when we have such incredible talent at home? That question has haunted me for 30 years. And now I want to address it head on. On this channel, I'll be covering something for surgeons, other things for general public. For surgeons, the things would be covered would be the psychological techniques that accelerate surgical skill development, how to make better decisions under pressure, why some surgeons burn out and others thrive for decades, and what you can do about it. Also, we'll be covering communication strategies that builds patients' trust immediately, and the hidden mental traps that sabotage performance. And for patients and general public, it will be what I call as surgical whistleblower. What are the wrong things that happen in surgical practice. The surgeons who are heroes and those who are villains. So I will be speaking those things openly about which usually surgeons don't talk. The disparities, the failures, but also the solutions, the potential, the power of change. So that's why me. A stage comes in life when you reassess your priorities, your possibilities and purpose. This is mine. To share what I have learned so that the next generation doesn't have to learn it the hard way as I did.